What could you save out of this? 5 to 8% savings over 5 years with 2% lower trend. So if you multiply that out in that range, you save between 35 and 50%. That's pretty significant. Take your current healthcare costs and go to your CEO and say, I think I can save you 50% of those costs accumulated over the next 5 years. And you can lower your prescription drug costs by 20 to 35%. Most prescription drugs are 15 to 20, 25%, even in some cases, of your whole total cost. Here's a general chart, and I'll show you some data that came from the industry. This is a chart I put together that's consistent with that and some of the other data that says, okay, according to what generation I put in and implementing, I get more savings as I go along. And all those programs I had on that one chart, we got all these different programs you could choose that you got a gazillion vendors out there. According to whether I just classified them as basic, expanded, and complete, and then I said there's even comprehensive, some future things that aren't on the list that are being developed. You should be at least able to, in today's world, do this. Expanded programs, not just some simple basics. So your savings in a second generation, which is where the world is 12 to 15%. Now let me show you, I think one of the next charts is from the American Academy of Actuaries. Yeah. Okay. I'm a member of the American Academy. There's a bunch of technical geeks like me, actuaries that are out there. They did an analysis of the industry. And most of this is consumer-driven with account-based plans. And some of these are even first generation, but a lot of them second generation. Here's what they found. Again, they weren't trying to drive. This wasn't an insurance industry trying to promote their products or some politician trying to say this is the way it goes. First year savings, 12 to 20%. I had 8 to 12% in my second generation, so it's actually low relative to what companies were actually experiencing. 2+ year savings, lower the trend by 3 to 5%. Basically, you can cut the trend in half. Trends have actually been down last year or two, so you can say, instead of 3 to 5 as a number, I'd say cut your trend in half. Cost shifting, studies indicated that that was not the case. They weren't just cost shifting, they actually lowering the cost by getting people engaged. Rand Corporation, they did a study in 2011, and they found that people with high deductibles, their healthcare spending dropped an average of 14%. Everybody's got studies out there, and you can take them or leave them. You say, well, that's just an industry study. Aetna and Cigna have got a reason to promote themselves, as do some of the consulting houses that are doing it. But